I'm excited for the new EMR because it means one chart for our patients in Northeastern Ontario. Imagine a patient now coming to HSN won't unnecessarily have to repeat their medical imaging exam or tell us their story over and over again. Their information is going to flow with them through their healthcare journey, and that's a big win for our patients.
One really positive thing about EMR is that when either of my parents, who are elderly, end up in Emerge, aren't having to retell their story every single time. They can have a quick look at that and have maybe a better idea as to what past treatment was, what procedures were done. They can look at all of those records in order to have a better idea as to what their treatment plan is when they're ruling out certain medical concerns.
I think the thing that makes me most excited about the electronic medical record project is the fact that there'll be seamless flow of information. And what I mean to say is that what's happened here at Health Sciences North will flow back to their home communities, and their primary care providers, their family physicians, their nurse practitioners will have instant access to what happened while they were in hospital. The other part of it too is that from a patient safety perspective, it reduces the amount of time between when a physician wants something to happen to a patient and when it actually happens to that patient. And for me, from a safety perspective, the fact that we're now going to verify the medications at bedside for our patients is huge.
I'm really excited for the EMR project. As a pharmacist, I will have instant access to physician notes. I will be able to see immediately when a patient received a dose of medication by looking at the electronic medication administration record. By having barcodes on all medications, the nurses will be able to barcode scan the medication to ensure that the correct medication is administered to the correct patient. By reviewing the electronic medication administration record, I will be able to see exactly which medication the patient received, when they last received it, and when their next dose is due.
One of the things that excites me most about EMR is the amount of information that will be available at the bedside of a patient. For example, when my dad needs to be here in hospital, anybody taking care of him will have access at the touch of a button to all of his scans, all of his latest test results, his blood work, so that the doctor knows everything and my dad gets quality care much sooner than he would if anybody had to wait for anything to come in.
We don't have to go looking for charts anymore. We don't have to worry if our orders were entered in a timely fashion. We don't have to worry if people can understand our handwriting. All of that information is right there in front of us, and we can provide better care for our patients from that perspective.
I am very excited for the implementation of Meditech Expanse, and especially the workstations on wheels, or the WOWs for nurses. The workstations on wheels will bring the chart directly to the patient's bedside and provide the most up-to-date information right at the point of care for nursing. It's also going to allow us to barcode scan all of the medications that we administer our patients, ensuring that we have the right medication for the right patient at the right time. This will significantly improve patient safety and provide time for nursing to actually do what technology can't, like caring for patients and providing them education about the treatments that they are receiving.